I said to people when I was diagnosed, I said, why me? But today I say, why not me? Because I sit here and I can tell you that breast cancer changed my life. Hi, I am Mesha-Gaye Ruddock, a 31 years old breast cancer survivor. I was diagnosed with breast cancer at the tender age of 28. I'd say that's very tender. I was diagnosed back in 2021, and today I stand before you simply encouraging women to get screened, encouraging women to do their risk assessments, and men even, if you are affected by the disease, but also reminding you that cancer is not a death sentence. You can rise above cancer. When I was diagnosed in 2021, I remember, and this is the description I use, it felt as though the earth had opened up beneath me, because nobody wants to be diagnosed with cancer. Oftentimes people think cancer is like it's end of life. No, like cancer means end all be all. But the truth is, there's so many sciences in place. Doctors are advancing in medicine, and especially if you happen to catch it early, which is why we say early detection saves lives, that is when you can have the best fighting chance against this disease. Luckily for me, when I felt my lump back in 2021, what it felt like was a hardening in my left breast. Of course, it felt different simply because I thankfully used to do my own breast self-exams. So I would stand before the mirror, I would do, hold up your hand and check and feel, which is something we should all be doing as women. And that was what helped me to notice the difference, So I picked up the hardening and I was like, this feels different. It was actually close to my menses. So at the time, the female body, it changes. So I didn't really take it too serious at the time. But even after my menses, I realized that it was still there. So at this point, I'm suspicious. So I tell my friends, I'm like, guys, there's this thing in my breast that it feels different from the rest of it. So can you feel it for me? And I remember them feeling it and one of them saying, Mesha, this is a mass. And I was like, girl, please don't, I know some women have lumpy breasts, so my mind didn't go to cancer. I wasn't thinking cancer at all, but I knew for sure that I needed to go check it out. So I went to my doctor, who also felt the hardening and was concerned, and encouraged me to do an ultrasound. When I did the ultrasound, the radiologist came in the room and explained to me that what they're seeing is concerning because it appears to be connected to blood vessels, and I think at that point now it felt serious for me because this isn't a cyst, this isn't something that can be drained, this is actually a mass. So in order to decide whether or not it's cancerous or not, we have to do a biopsy or an MRI, a breast MRI. I remember feeling emotional at that time, but I'm also going with emotion simply because I need to find out what this is. So my general practitioner encouraged me, once he got back my ultrasound results, to do a needle biopsy. So that was what I did back in July of 2021. And the wait was long. It felt excruciatingly long, but even during the wait, I was hoping for the best result, praying that it's not cancer, trying to eliminate the thoughts of cancer. But unfortunately for me, on the 9th of September, my GP told me that I was diagnosed with stage 1 invasive ductal carcinoma. I don't have any form of predisposition to the disease, and I say that to say I don't know of any family member on either sides of my family that was diagnosed with cancer. So I never imagined cancer being the thing that I'd have to be facing at 28. Nevertheless, I had to put on my big girl panties. I certainly went into, I'm going to describe it as a depressive state following the news. And I want to say that's normal. People go into shock and people treat shock differently. But I remember I had to get the rest of the week off from work. I cried and cried and cried. But I had to come to grips with it and start to get going because this disease is time sensitive. So you can't, I don't encourage anyone who has a diagnosis to sit with it and watch and wait. Get going. I was referred to a breast oncologist, the only in the island, Dr. Jason Copeland, who to this day I believe is my, saving grace. He's such an awesome doctor. And he's so informed, so knowledgeable, and he would have walked me through what my outlook was, whether I'd have to do a lumpectomy, a mastectomy, chemo, radiation. So all of this we're now discussing. It was certainly scary, but I had the support. I had my friends, I had my family, I had my co-workers. I felt like I had a village that really and truly uplifted me through this very difficult time. I'd never been hospitalized a day in my life, other than perhaps when I was born. So now, facing all of the ramifications of being diagnosed, which look like test after test after test, I had to do a CT scan, never done a CT scan before. Come to find out I'm allergic to iodine because they use that to get the imaging. Then I had to do a breast MRI, then a bone scan. It's just test after test after test. And that all adds up. I'm not going to lie to you, that all adds up. So you don't only have the emotional challenge, but there's also the financial concern. And I tell you, some people, I'm not telling a lie, if they're diagnosed with cancer, frustration kills them more than anything. But like I said, for me, I felt like there was hope and I needed to just keep going. So when I did my breast MRI, the result identified that there was a mass in my right breast. So okay, we knew there was something in the left one, right? But not only was there something in the left one that we felt on the surface for the most part, but there was what appeared to be a mass in my right breast, closer to the chest wall. And this was even more scary because most women are diagnosed with breast cancer of one breast. Here I am, the anomaly, diagnosed with bilateral breast cancer. Only 3% of women in the world are diagnosed with bilateral breast cancer. And this was even more scary because the size of that mass was larger than the one in the left. So now we're looking like maybe it's no longer stage 1, maybe it's stage 2. And depending on the stage, it might be a case where it's spread more than it hasn't. And I'm telling you, I'm going through it. I'm not going to lie. I experienced the mental challenge of, being diagnosed clinically depressed because I was going through it. But thankfully, like I said, I was guided. So now not only would I have to look at removing one breast, I'm now faced with removing both. So a double mastectomy was in the cards, and I was diagnosed September 9th. I did surgery October 11th. And what I did was a double nipple sparing mastectomy with an immediate reconstruction and removal of lymph nodes on both sides. That's in an effort to check if there's any evidence of spread. I mean, I don't want people to be afraid to find out, to be afraid to get it checked, to be afraid to go to the doctor, simply because it's better to know, especially to know early than not to know at all and it's gotten worse. Because luckily for me, I was able to remove my breast tissue conservatively because now I have what appears to be my breast, simply because my doctor would have spared my nipple. So there's so many advancements in treatment that can make you look and feel like a woman, make you look and feel beautiful. A lot of people think that with cancer, there are certain treatments that are standard. First off, people think chemotherapy is necessary. And there are times when it is, but there are times when you don't have to go that route as well. For me, going through my journey, I remember praying for every single outcome. Everyone's cancer differs. I was diagnosed with invasive ductal carcinoma, but the truth is the stage is different, the type is different. So for women, there are I earned a medical degree throughout this entire process, might I add. So you have HER2 positive breast cancer, estrogen and progesterone positive breast cancer, and triple negative breast cancer. Triple negative is known as the most aggressive kind, which affects, they say, primarily Black American, Black women. I was diagnosed with estrogen progesterone positive type, which is the least aggressive kind. Like I said, I prayed for that outcome and I got it, thanks be to God. At the same time, I was praying not to have to do chemo, because chemo is daunting, and it wasn't just about the physical aspect of it, because women lose their hair and all of that. It was, your body goes through so much, loss of appetite, nausea, you feel sick for days on end. I didn't want to go through that. I really don't want anybody to go through it, but if it is the method of treatment and you have to, then by all means. But I remember praying not to have to do chemo, and after my surgery, following the pathology and checks of my breast tissues, they would have found that, yes, confirming that the left had stage 1, but the right had stage 0, what they call DCIS, which was again a blessing. So that was me being a benefit of early detection. Again, the lymph nodes had no evidence of spread. That again was an amazing thing. So my doctor would have had, my oncologist surgically would have had clear margins. So from a surgical standpoint, I'm cancer free. But at the same time, doctors want to ensure that this thing don't come back. So the treatment outlook for me, like I said, was chemo, possibly radiation, maybe, and hormone therapy. But because there was no evidence of spread, to ensure I don't do chemo, I had to do a test, which was very expensive, I remember. And essentially it tells you what % benefit chemotherapy would be to you. And for me, it wasn't that great of a benefit. So I made an informed decision to stay the route of hormone therapy, which looks like a pill a day and an injection every 12 months. Still not fun. And essentially, I'm menopausal at 31, because what the therapy or the treatment is doing is it's staving off my body from producing estrogen, which is what the cancer was responding to. And I'm staying that course for 5 years, and at the end of 5 years is when you're deemed to be in remission. And I just hope that I can live and thrive and enjoy life. I mean, I've claimed the healing, and I'm just here to encourage others, and I'm grateful just to be here.
So are you involved in any advocacy or support initiative for breast cancer awareness?
I am. It would be remiss of me not to be. I don't know, like I said, there is purpose over my life. I didn't know about the Jamaica Reach to Recovery prior. I'm aware of Jamaica Cancer Society, but I didn't know there was a whole arm that deals with breast cancer. So the Jamaica Reach to Recovery is the breast cancer support arm of the Jamaica Cancer Society, and it's a group of women and men from all walks of life who have come together simply to provide emotional, psychological, and even financial support. I think I may be one of the youngest members, but I'm happy to be a part of it because I know it's for a cause that's greater than my own. And we're gearing up now to participate in the Pink Run on the 27th of October. So yeah, that's where my advocacy lies. I'm also keen on speaking about it, not just in October. I tell people, I feel like we vomit pink all of October, and it's almost for some a little difficult, because even sitting here before you, I've been kind of repeating the story just to say, and sometimes it gets overwhelming because I've been there, but I'm also talking about it over and over again. I want us to talk about it 365 days of the year. I want us to talk about it every single month because it affects us every single day, and I don't talk about it simply from a survivor perspective. I talk about it from my family, the caregivers. They go through it too, and they deal with it differently. Some are there for you supportive, some shut down. I think more doctors should look into specializing. I know we have a shortage of radiologists, So more doctors can also look into specializing in that field so that, when women are screened, we have quicker turnaround times of the results. There's a word that people throw around, fear. And I say it's false evidence appearing real. Banish it. Like, yes, it's a disease that can genuinely take your life if it's found out late, but you're bigger and better than that. Like, I don't know. For me, it was just, I am still in awe at how I went through the motions. So there was ordinance for me, and I think I was guided, guarded, and protected throughout the journey. So I didn't feel alone because I remember praying and begging God not to leave me, I mean, I tell you, I'm going to go through it, because in that same time, I was in a relationship that was rough. And some people don't talk about that too, how it affects your relationships. And it didn't affect my relationship, but the relationship is toxic. I did have to leave it, and breast cancer made me do that. So I think I gained more strength coming out of it. Prior to my diagnosis, I just like about life. Like, we just live and enjoy life, and I'm not telling a lie, making poor choices, drinking, palaving, living life, enjoying myself. But I had to literally, this really brought a lot to perspective for me. I had to pause, take stock, not only of the things and choices I made, the people in my life. It's just a whole host of things. I said to people when I was diagnosed, I said, why me? But today I say, why not me? Because I sit here and I can tell you that breast cancer changed my life. Breast cancer changed my life. I genuinely think there is ordinance over my life. I believe I've been placed here for a purpose, and I'm figuring that purpose out. I mean, I've gotten the confidence to sit before a camera and tell you that this happened to me, but also to encourage women and men just to be in tune with your bodies. Like, take nothing for granted, ignore nothing. If something feels different, if something feels off, go and get it checked. If you have family history of certain diseases, try to start screening before you get to the age of the family member who suffered from the disease, Be responsible. Life is here for living. Just do your part. It's not here to take you. You're here to get rid of it. It's not a death sentence. You can overcome. You are stronger than cancer. And you can also be a testimony for someone else. Yeah. You've got this.